Hi, my name is Patty Gonzalez, and I'm going to perform an eye, ear, nose, and throat assessment, as well as skin, hair, and nails. This is my patient. He is a 39-year-old Hispanic male. Sir, do you have any questions before we begin our assessment?
No.
I'm going to wash my hands, and I would ask him for his name and date of birth. So he told me his name and date of birth. He is the correct patient. I'm going to begin by assessing his eyes. I would grab the ophthalmoscope, look into his eye. I would check also for any drainage coming from his eyes, any crusting to the eyelashes. I'm going to look at your Do you wear any contacts or glasses?
No.
I'm going to then look at his eyelids to see if there's any swelling. His eyelashes. The next assessment that I would go to is his ears. Have you had any problems with your ears?
When I was little, but not recently.
Are you having any tenderness in your ear? If I palpate your ear?
No.
And I am examining the outer ear, the pinna, for any redness, any swelling, and he is saying that he does not have any of that. And for this assessment, I would use my otoscope. I would hold the handle with my fingertips and use my pinky to adjust this. And because he is an adult, I am going to pull his ear up and back to help straighten out the ear canal. So here I'm using the otoscope, and I'm gently moving it around to look at his inner ear, his tympanic membrane. Okay, you may tilt your head back this way, and then I'll go look in the other side as well. Now the next thing that I would look at, that we're going to examine, is his nose. Have you had a cold recently? Any drainage? No? So then I can use a light from either the ophthalmoscope to look inside. So first of all, I would check to see if he has any deviation. Can you tilt your head back, please? So I would use the light to look inside each nostril. Okay, maybe tilt your head down. Now the next part of the assessment I would work on, or that I'm going to work on, is his throat. So sir, have you had any sore throats recently? Do you still have your tonsils in?
Mm-hmm.
Yes, and you've not had any issues with your throat at any point recently?
Not that I remember.
Okay, so then I would grab a tongue blade. May I have you say, open your mouth, stick out your tongue, stick the tongue blade in, say ah. Okay, his uvula looks midline and center, looks good. There's no redness, no swelling in his throat. Are you having do you have any trouble swallowing? No? Okay. Let's see. Do you go to the, have you had any episodes of strep throat or anything like that?
Probably in the past, but not recently.
Okay. Now I'm going to move on to his skin assessment. Do you have any open sores or wounds on your body that you may know of?
No.
No? Do you have any rash or itching anywhere?
No.
No? So I will go ahead and look at his skin turgor. And I'm going to check for any clubbing in his fingers. And I'm going to assess for a capillary refill. Okay, I'm going to have you take off one of your shoes and your socks. Okay, let me put that back on. We'll check the other.
Turn it on.
Yes, please. Okay. Okay, have you had any, now I'm going, my next assessment would be assessing his hair. Have you had any trouble with any major hair loss?
No.
No, any type of dandruff that you deal with?
No.
No? Have you used dyes or colors in your hair?
No.
Okay. I'm just going to inspect. Okay. And could you go ahead and smile for me so that I can see your teeth? Okay, stick out your tongue. Any major problems with your teeth? Any trouble that you may be having? No sores in your mouth either?
No.
Okay. And one thing that earlier, when we were assessing your nose, I'm going to check to see if you have any masses in your nose. Does that hurt? Can you go ahead and swallow for me? All right, I believe this completes my assessment. Thank you for watching and have a blessed day.